I'm gonna help unwind things right here. Good, right there. Oh yeah. Have a breath. What's up, everybody? I'm Dr. Jamal Fuster Cortez, and I'm here with my good friend Tayamarie. Very, very excited to be able to share her story as 500 million people in the world are experiencing low back pain right now. Crazy. And Tayamarie came in as, if you guys couldn't tell, she gets after it at the gym as well too. Seems to just be a thing here, as proudly representing Gym of Tucson. But really excited for her to just share more of her story, where she was at when she first came in, and how her experience has been here at the source. Care to share with the good people?
Yeah. Hi. Yeah, before I came in here, I had a lot of back pain, was having trouble getting up and down off the floor, having a lot of sleeping issues, knee pain, elbow pain. And since I've been coming here, Dr. Jamal has fixed me up, and now I have zero pain. I look forward to coming here each week because, as you can see, I go to the gym a lot.
So when you first came in, I know that sleeping was an issue. You're tossing and turning, and that hip and that low back pain was really causing you a lot of discomfort. I also know that just rotating your head side to side was bothersome. And then, hey, throwing weight at the gym. How has things shifted since then?
Okay, so sleeping is great now. I was waking up 7 to 8 times a night, just tossing and turning. My back was hurting really bad, shooting pains down my back, down my leg. And now, since I've been coming here, I have zero back pain. Lifting is better. My neck is better. Everything is just 100% better.
I want to share a little bit of the anatomy and why a lot of people experience pain, especially in the low back. So in the source model, and what we study with Kairos training culture as well too, is we study compressive forces and tensile forces. A lot of people deadlifting, back squatting, all the things, just going through life, also sitting a lot, they experience a lot more compression in their lumbar spine. Why is this important and why is this relevant? When there's been a micro or a macro, meaning a small or a large trauma, a lot of times physically alone, this leads to a lot of pain being signaled from the low back that's being sent from the brain. Pain is generated in the brain. Say it with me. Pain is generated in the brain. Very important to be able to appreciate. So a lot of the times the brain gets stuck in a cycle of pain. And when a lot of people have injured their back in the past due to a lot of the different exercises at the gym, due to dysfunctional movement patterns, the brain essentially loses awareness of what's going on in the lumbar spine. In particular, I'm just going to focus there. And that's important because then the brain can't accurately detect what's going on. And then the brain learns to actually be in pain more or send more of those signals more often. Why? Well, it's trying to protect itself from doing more damage and doing more injury. Why? Well, back in the day, if we got injured, well, we would be at risk of being eaten by a saber-toothed tiger. So for biology and how it's adapted over the last few thousand years, we're not getting chased by saber-toothed tigers for the most part anymore. A lot of times we're doing the damage ourselves. It's great. It's great. So anyways, a lot of times I find my people that are experiencing chronic low back issues and discomfort, it's because that the lumbar spine isn't moving segmentally with these different aspects. As this is important, I want to key in on this. When the joints aren't moving as they need to, where the two bones meet, a lot of the time that's where inflammation occur and something that is called a subluxation. You don't need to remember the name of it, but it's important because that's what we're specifically looking for. It's when a specific segment of the spine isn't moving at it as it needs to, that then impacts how the muscles are firing, that then impacts the movement of the joint itself, that then impacts the skin, the histological component as well too. A lot of times the viscera or the organ function, which is getting nerve flow or connection from the brain and functionality, is also disrupted as well too. So there's a very specific way in which we take care of the nervous system, in which we take care of the spine, where there's been a lot of research around as well too. So all that to say, when there's been chronic issues, well, there's probably been chronic dysfunctional patterns, and the brain's chronically been in a maladaptive state, and it's having a tough time breaking that cycle. That's why an adjustment at the specific time and place can be an asset, but also being able to make corrective exercises recommendations, whether it be foam rolling, whether it be teaching the hip hinge as well too, as a lot of time people aren't utilizing their whole body or their whole butt as well too, and that's important because then the lumbar spine's like, yeah, I got it. So there's a lot more to chiropractic care than, I'm not saying just the adjustment because that's very profound, but that's one aspect to it, at least in how we take care of people. So I'm gonna walk y'all through an adjustment with Tayamarie. All right, big breath, ma'am. Another breath into your low back. Exhale, audible sigh. Okay, so a lot of times we start at the foot of the table, and I might just test to see if there's a short leg as well too, as typically we find functionally when the hip, the ilium, or the sacrum, or the last part of the spine can rock posteriorly, that can shorten things. As we study the fascia, we study the myofascial chains by Thomas Myers, Anatomy Trains, highly recommend it. And we can see the distortion patterns or the derangement patterns from the calf into the hamstring, but then we need to find, what's the cause of things as well too. So people might be experiencing low back pain, but it actually might be related to the hip. It actually might be related to the sacrum as well too. Big breath in. Exhale, audible sigh. Okay, so as I'm palpating here, like I said, Tayamarie gets after it. So a lot of the times the quadratus lumborum, or the muscles here as well too, can be in a protective muscle spasm, so they can be firing. That could be an indicator if we need to adjust the lumbar spine in particular. When I press in, checking how the 4 quadrants of the sacrum are doing. There's some compression in the upper right aspects of her sacrum, but when I check her hips or her iliums, the joint play is doing really, really well. So to differentiate, I'm going to see how the sacrum's moving or not moving. And if y'all look right here at the base of the sacrum, there's some bunching right about there. Versus if I were to lift, I'm looking to see if there's any activation maybe of the lumbar paraspinals as well too. Doesn't seem to be the case. So Tayamarie, face me this side up. And even with these braids, your hair gets caught in the table. So good. All right, so it's important when there's been a significant amount of compression to help open up the joint space. Have a big breath in. So that way we can create more. Good. Let's have you go face down. Create a more ideal tensional space. Good. There's still some charge in the paraspinals, so I'm actually going to adjust her at L2 as well too. Face me this side up. All right. Good. You let those shoulders go. Scoot you towards me. You're doing great. Deep breath in here. I'm gonna help unwind things right here. Good, right there. Good. Let's have you go face down. Better, more supple. Big breath in here. Exhale slow. Good. Okay, now there's more joint play, which is lovely to be able to appreciate. There's a decreased hypertonicity of the lumbar paraspinals as well too. Let's have you shift and go face up, Tayamarie. How we doing? Yeah. All right. Open things here. Open up the sinuses a bit for you as well, sister. All right. It's important we check the whole spine. Base of the neck is doing great. When she first came in, there was a lot of rigidity. at the base of the neck that was impeding with her lateral flexion. She started out at about 50% range of motion on both sides. Open up things here. Open up things here. Good. You let your head just fall away, sis. Deep breath in. Exhale. Good. Last one. Let's have you bend both your knees. Beautiful. Give this nice square big old hug. Yeah. So it's great to use different instruments or tools sometimes with adjusting because it helps open up the joint spaces in the mid back in particular. Good. And you let your head just fall back. You're going to a glute hip bridge. Yep. Lift the hips. You got it.
Oh, yeah.
Have a breath. Great work. Nice. Come to a seated position, sister. Good. And you can kick your legs that way. Tall breath in. Exhale. Good. I just want to check one more thing. Just a little bit more. Good. Lean back into my leg. Good. Mind popping out this hoop for me? Oh, wow, that was easy. Okay. Okay, I'm gonna lean you this way. Good, there. I'm gonna lean you forward here, sister. Good. Fantastic. Good breath in. Exhale. Ah, yeah, nice. So sometimes, an adjustment just may not go through all the way, supine or seated. So there's a number of different ways we can take care of our people. Thank you so much. But if you have any questions about low back pain or discomfort, or you're experiencing some chronic issues and you need some support, you're here in Arizona, you're here in Tucson, we're here to help. So feel free to drop a comment in the box below or whatever. Feel free to click that subscribe button. I haven't said that yet, but feel free to click that subscribe button, as this is going to be one video of about 24, which I'm very excited to roll out the next 12 weeks or so. And until next time, peace.